So we're going to do patient teaching, and before I start with my patient teaching, I want to make some things known. So before presenting my patient with information, I will evaluate what teaching style I would be using, and in this case I'm going to use cognitive. With cognitive, it's basically adding to their knowledge. So I might begin with asking them questions about what they already know about this medication, or even possibly what they know about their condition. And with that information, I will be able to know, build on the knowledge that they already have regarding this drug. As far as how I would provide this teaching, I could provide written material that I printed out, and I could provide material through electronic devices. And so at this point, I would just really evaluate and ask my client's preference of how they learn and what they use best and what they will most likely refer back to if they have any inquiries or questions regarding the medication. So I could easily print out a paper and hand that to them if that's how they like, hands-on, something that they can pick up, look at, and refer to. Or if they're more tech savvy, then I can show them how to access the information through their mobile device or tablet. A common patient education barrier that might impede in my patient education could be illiteracy. Say if I do provide my patient with written material printed out on paper and they're unable to read that material, alternative for me to assist them would be to read the material out loud to them, provide pictures, graphics, and most likely examples. And so with that, I would make sure, check their understanding and make sure that they're competent of the information that's provided. So we're going to get started. Hi, I'm Destiny. I'm your student nurse. And I'm just going to go over this medication that your provider prescribed you. Make sure that you know about it and how it's supposed to work, okay? So your doctor prescribed you Fosamprenavir. It is also known as Lexivia. This is an antiretroviral medication, usually for HIV treatment, okay? It inhibits the activity of the retrovirus, okay? It's a protease inhibitor. It's usually used as treatment and post-exposure prophylaxis for HIV. So when taking this medication, you need to know how it works in your body. And so basically, when you are administered this medication, it will bind to the active site of HIV protease, which will prevent the production of the viral infection. So basically, instead of making a full infectious HIV virus, it's gonna basically produce a immature non-viral infectious. And so a benefit about this is that it may slow the destruction of your immune system, which we all know usually HIV is prone to do so, okay? So this drug can be given orally, or it is given orally. It can be given by suspension, which is usually a syrup, a thick liquid, and that could be given usually 50 milligrams by 1 ml. It can also be given by tablet, 700 milligrams. And it's important for me to let you know the peak of this medication. And so when you take this medication, within 2.5 to 4 hours is when it reaches its peak, which means that it's at its highest potential. It's doing the most work at that time. So when taking this medication, it's very important for you to know that you should take this exactly how the doctor prescribed it to be taken. Make sure that you do not miss any doses. It is very important to take all doses. In the case that you do miss a dose, within that 4-hour time frame of when the dose was supposed to be taken, go ahead, as soon as you realize that you've missed that dose, take that dose. And so if it's closer to your next dose, or if it is time for your next dose, please do not double up on your doses. Just take the dose that's prescribed for that time, okay? For the oral suspension route, you want to make sure that you shake it very well before using, and you want to be sure that you have a medication measuring device to measure the dosage. So it could be a cup, it could be a syringe, it could be a teaspoon, as long as it's labeled with the measurement so that you know that you're giving the right dose. In the tablet form, you can take without food, and if you do decide to take it with food, then you want to be sure that you do not take it with a high-fat meal because it contraindicates within the body. With both these forms, you want to be sure that Fosamprenavir is taken with all of your other antiretroviral medications. Some side effects that you might experience when taking this medication could include fatigue, headache, abdominal pain, some nausea, vomiting, diarrhea. It might increase your glucose, so you might become hypoglycemia. It might increase your cholesterol. You might experience some rashes and or angioedema. Also, if you realize and notice that any of these side effects you are experiencing are persistent and become severe, that you notify your provider as soon as you get a chance. Some precautions to take when taking this medication. I want to speak on the contraindications with other medications. So, yeah, it's common that you take this Fosamprenavir with your other antiretroviral medications, but there's also handfuls of other medications that it contraindicates with, and so you want to be sure that your provider knows all the medications you're taking, whether it's over the counter, whether it's prescribed, whether it's herbal, especially the herbal supplements, because a lot of people do not notify prescribers that they're taking a herbal supplement, which sometimes mostly indicates with a medication. And so in this case, St. John Wort, it's a herbal, it could be in a pill form, it's a flower, it can be in a pill form, it could be made into a tea, and it's usually used to ease the symptoms of depression. And so if you take this with Fosamprenavir, it can greatly reduce the drug levels in your blood so that the drug is less effective and you might become resistant to it. Also, as well, as far as radiology and lab reports, when taking this medication, it could increase your ALT, your AST, the liver enzymes. It could indicate hepatic damage, okay? So you want to watch for that. It could increase your glucose, like I said, hypoglycemia, your lipase, triglyceride levels, and it may decrease your neutrophil count, those white blood cells, okay, that help fight bacterial infections. So overview of what I'm teaching, I want you to be clear that this drug is not a cure for HIV, okay? This drug does not reduce the risk and the transmission of HIV to others, so you want to make sure that you are being cautious and you're still taking precautions. This drug, however, may reduce the risk of the progression of AIDS, and so it's keeping your levels good so that the HIV doesn't progress to full-blown AIDS, okay? Fosamprenavir must be used with other antiretroviral drugs, like I said before. So it's working as a combination with all your other medications. Please do not alter the dose. Please do not stop taking the drug without consulting your provider, okay? It is very important that you take it as it is prescribed to be taken. Once again, this drug does interact with many other drugs, and so be sure that you let your prescriber know of all types and forms of medications that you may be taking, including herbal supplements. It is to be noted that some body fat may redistribute or accumulate in some areas. Please report any and all adverse reactions to your prescriber. And also for pregnant women, if you are taking Fosamprenavir, you are able to enroll in an antiretroviral pregnancy registry, and I have provided the number here for you. And so there are also some nursing considerations that I take in account, like monitoring you for your liver enzymes and your glucose and things of that nature. I want to check, for hemophilia to make sure you don't have any spontaneous bleedings. I want to make sure that you have no allergies to these drugs, and just your overall wellness, your acceptance of the medication. And so at this time, I would see, do you have any questions? You will provide me with any questions that you have. And the way that I can evaluate that you have learned or that you understand the concept of this medication and the administration of it, I will ask you to provide teach back. So I will have you describe back to me maybe the way that you're supposed to take the medication. I will ask you, if you missed a dose, what would you do? And you will give me your response. And in your response, I will know then if you were understanding of the information that was provided and that you are well aware of all the benefits, all the risks, all the information needed to know for this medication. And that is all. Thank you.